Did you know that approximately 1 in 3 Canadians will develop shingles in their lifetime? Well, Dr. Vivian Brown is the author of the New Woman's Guide to Healthy Aging and is a family physician in Toronto, and she advocates about raising awareness about women's health issues, preventative health care, and healthy aging. She joins me today to talk about shingles. Dr. Brown, welcome to Life Unrehearsed.
Thanks, Matt. Happy to be here.
Well, glad you could join us here on a Sunday on Life Unrehearsed. Now, shingles definitely not just a woman's issue for women's health, but also men's health issue. So glad we can talk about this. And so for our listeners, what exactly is shingles and how does somebody catch it, if you will?
So shingles really is a reactivation of the chickenpox virus. And what that means is for most of us over the age of 50, we had chickenpox when we were kids. We suppressed that virus, but we didn't get rid of it. And as our immune system gets a little bit weaker with age, that virus comes to the surface again and causes shingles. Women are more at risk than men, but it happens to everybody. And if you live till you're 80, your risk is actually 1 in 2. It's a very, very common disease.
My goodness, I was just going to ask that about, who is more likely to get shingles. So obviously, as we age every year, that the chances go up. And 1 in 2 over 80, amazing statistic I didn't know about. You mentioned women are a little more vulnerable, but is it a high percentage or is it still prevalent for men as well?
It's still very prevalent for men, and what we know is our immune system gets weaker with age. That's the most common reason. But we also know that people under the age of 50 are at risk if their immune system is compromised. So in Canada, we have guidelines to immunize everybody over the age of 60, but we also have, over the age of 50, but we also have guidelines that suggest if you're between 18 and 50 and you have certain diseases, if you've got a compromised immune system because of another disease or a drug that you're on, you should consider getting the shingles vaccine as well.
All right, so I want to talk about the vaccine for a second here because I am assuming here that we're going to need, is it a prescription for the vaccine from a doctor, or how do you go about it to get a vaccine?
Yeah, well, it's different in different provinces because in some provinces, pharmacists have the ability to immunize, and in some provinces, public health does most of the immunization. But the bottom line is you get a prescription from your doctor. It's a series of 2 shots, one when you first start and one 2 to 6 months later, and it gives you long-term immunity. In medicine, we never say forever, but saying long-term is a really good statement. It means that as we've looked at this for more than 11 to 12 years, and the modeling goes out to 20 years, we're seeing really good efficacy from this vaccine. People don't end up getting shingles if they've been vaccinated. And if they do have a case, it tends to be very, very mild. It's a very strong vaccine. It works well.
Listening to Life Unrehearsed, Matt Delvecchio here, and I'm talking to Dr. Vivian Brown about shingles. So I was going to ask you about the effectiveness of the vaccine. So it's a 2-shot process, and you said the second one takes place, 2 to 6 months after the first one? Is that what you
Correct.
said? All right.
And in this vaccine, there's an added irritant. In medicine, we call it an adjuvant, but basically it's an irritant. It makes your arm really sore. But what that does is it really attracts all your immune cells. And so the data suggests that this works so well, it's one of the best vaccines we have on the market with over a 90% efficacy, which is really great. When we look at some other vaccines in adults, we're looking at numbers around 60%. So this is a really high efficacy vaccine.
90%, yeah, quite surprised with that. All right, Dr. Brown, I'm 58 years old, male. I don't have my vaccine yet, and what's stopping me from getting it except just being lazy and not getting it done?
And I guess the cost, but the reality is some people get shingles and it's a minor rash and it's no big deal. Other people get shingles and they get terrible nerve pain that can last months to years after the rash is gone. And occasionally shingles can do even more damage. It can go to your brain. It can go to other places in the body. I have a patient who ended up with cognitive impairment. It really affected his ability to think because he had shingles encephalitis. So this is a vaccine that can prevent this disease. Why wouldn't you want to get it? I couldn't wait.
It makes a lot of sense. And so As you know, here in Quebec, you're in Toronto, but this is a nationwide issue with having family doctors because you do need a prescription. If you're lucky enough to have a doctor and get a prescription, is there a reason why a doctor would say no? Let's say if you're over 50 years old?
I don't think there's very many reasons to say no. I think it's more explaining about the side effects, that really sore arm. Some people get fatigue. Some people can feel, quote unquote, they've been hit by a bus for a day or two after the vaccine because their immune system is being stimulated. It's really just to have a sense that anyone taking a vaccine understands what to expect. And with this vaccine, I personally got a very sore arm, but after a day or two, that was gone. And that's your immune system reacting. So I don't see why people don't jump to this, because if you've ever seen anybody with a bad case of shingles, you never want to be that person. That chronic nerve pain is just unrelenting.
Right. And talking with Dr. Vivian Brown here about shingles. And yes, I know a few people who have had it. And like you said, one or two wasn't so bad, but those that did get it, boy, oh boy, it was very painful and kind of frustrating to know that a vaccine is most likely going to be the solution, and just get it done. Now, let's say you haven't been vaccinated and you get shingles. Dr. Brown, what are the methods that are being done today to treat shingles?
So there are good antiviral medications on the market, and they stop the virus from doubling. So what that means is they help the rash heal up a little bit faster. But unfortunately, the nerve damage is done before the rash even breaks out. And so the antiviral medications that we have don't alter that sort of that path to chronic pain, which means it's too late by the time you know you have it. The antivirals won't stop the pain. And if someone has had an episode of shingles, there is a risk of getting a second episode. So in Canada, we say even if you've had a case of shingles, it's worth it to take the vaccine a year later, and that will reduce your risk of getting a second episode. In the U.S., because they're seeing so many cases, they're saying don't even wait a year. Just wait till the crusted lesions heal, and then you should take the vaccine. So having had an episode of shingles doesn't protect you from getting another episode.
Not making you immune, as some would think. Now, we're talking about these medications. Are they? How is that? Is it creams? Because we're talking about nerves, or is it's creams? Is it?
There is a cream, but it doesn't work well. It's the oral medication. It's oral antiviral medications. Famciclovir, valciclovir. These are the common ones that are used. Acyclovir, and this would be a prescription medication from your physician for about 7 days. Again, it'll help the rash heal faster. It'll help you not spread the virus to other parts of your body, but unfortunately it doesn't reduce your risk of nerve pain.
Right, and the damage is already done. Best
Correct.
To get the vaccine in advance to avoid all that. Well, Dr. Brown, I really want to thank you for educating us here on Life Unrehearsed, and thank you for taking some time here on a Sunday.
Thank you, Matt. Go get your vaccine. It's a good one.
Yes, I'll be making a call tomorrow. All right. That's Dr. Vivian Brown, family physician based in Toronto, author of The New Women's Guide to Healthy Aging and associate professor at the University of Toronto.